A lot of questions as there are seemingly new developments by the hour, and we want to get you the facts from experts on the front line. So I'm pleased to bring in Dr. Rahul Khare. He's an emergency physician and founder of Innovative Care, a group of medical practices here in Chicago. Doctor, thank you so much for taking the time. First off, I just want your perspective, what you're seeing here in Chicago right now. How many cases do you have? Do you have more than you saw a few weeks ago, or do they appear to be leveling off?
So we've had 270 positive COVID-19 cases here at my clinic. So that's a significant amount. We've tested over 1,700 patients. So we're definitely seeing a significant amount of COVID-19. The question is, are we peaking or not? Definitely decreasing the trajectory. We were going exponential. We were doubling almost every 2 to 3 days, and we've seemed to decrease in the increases, but we're still seeing a significant amount of cases. So I would say within a week, 7 to 10 days in our community in Chicago, we will be peaking for sure.
And how many, because you are conducting COVID-19 tests, are you still limited to who you can be testing, so only symptomatic patients, or have you been able to expand who you're able to test?
Right. In the last 5 days, we've actually opened up to anyone who wants to be tested. We will do a COVID-19 test. It makes more sense if you're symptomatic or you've been exposed, or there's a good reason, such as you're a healthcare worker or work in a nursing home facility, to get this test. But if someone is extremely anxious about it and feels like they were exposed, we can do the test. That's not a problem.
So I also want your opinion. What do you need to see to say, okay, we can ease up on social distancing and people who are working from home can return to work?
So first and foremost, we have to make sure we have enough ventilators for the critically ill. I think people aren't realizing the whole reason we wanted to bend the curve or decrease the amount of people was that we didn't want a lot of people getting sick at the same time. And we didn't know much about the coronavirus and how it would affect us in America. So we're still learning about that. We have not peaked yet, but we're getting close. So I think in the next week or so, we will definitely overcome that issue of ventilators. But the second thing is, I want to make sure that we already know about herd immunity. About 80% of the population needs to have antigens or been exposed. The safest way to create herd immunity is to get 80% or more people vaccinated. That's not an option for us. We're still a year away from vaccination. So right now, we definitely don't have 80% of the people having had COVID-19. So I'm very scared about opening it up. And what we're going to have to do, and I think this is where the CDC has to guide us, is that we're going to have high-risk patient populations who are like our elderly parents, as well as lung disease, other chronic illnesses, and then low-risk patients. And then those who have had COVID-19 or have had serologic testing showing antibodies to it, and those who have not. Those who are immune and those who are not immune. So I think you're going to have these two categories that have to be put in place. And then with the guidance of the government, be it local or federal, we will then be able to say, okay, if you're low risk, and you can go back out, but know that you may get it because there will be a resurgence of COVID-19 after shelter in place is brought to an end. We know this. We will start passing it again. So we have to be very careful. So after the peak, that's when we can start to talk about it. And whenever that is, we have to be prepared for a resurgent, and we have to be very, very careful about our sick population, our high-risk population, because they can still get it, and unfortunately, they can still die.
Absolutely. Dr. Rahul Khare, thank you so much for taking the time. Really appreciate it.
Thanks for having me.
In the latest installment of Newsy's Life Has Changed, we'll introduce you to a New Orleans grocery store owner whose shop is the only one feeding